I see you. I don't know what you're going through at this time, but know that no condition is permanent. You are the expert of you. We in healthcare world actually work for you, not the other way around. And you get to choose who do you want to have in your healthcare car.
Today, I am honored to bring aboard someone who is not just a colleague, but she's a friend of mine. Dr. Adriana Kekic spent years at Mayo Clinic as a pharmacogenomics specialist and is now the founder and CEO of Futurum, which is a company that focuses on concierge longevity by understanding your genetics. What she's offering today are real world examples that come to you with no price tag attached. Today, we're going to talk about the things that don't cost you anything, the things that you can do to improve your longevity exactly where you're at. First of all, I'm so excited to have you today, Adriana. We've known each other now for, gosh, what, four, maybe three?
Yeah, close to.
Like three,
Yeah.
4 years. So you
Mhm.
originally reached out to me on LinkedIn.
Yes.
And we were
Yes.
both working at Mayo Clinic at the time in like completely different areas. So
Yes.
I was working on a neuro ENT plastics floor in the hospital, and you were working as a pharmacist.
Yeah.
And tell me a little about what you did in your role there.
Yeah, at that time when we connected, I was within the Center of Individualized Medicine working as pharmacogenomic pharmacist. I'm chuckling because just saying that sounds like, what exactly is that?
Yeah,
Both
what
things.
exactly is it for people who don't know?
Yeah. So I'm a pharmacist trained in genetics. This is what I did at Mayo Clinic for almost a decade. What that means is in pharmacology or in pharmacy, we help people and clinicians and our healthcare professional colleagues really design or help them guide what medications or treatments would be most personalized and appropriate for a person who needs to get a treatment. So pharmacists do a lot more than just count pills. And I always start with saying that because genetics plays role in terms of how you respond to medications, which is essentially one of the things that I did there as well. So your genes, so two of us can take the same medication correctly prescribed for the same correctly diagnosed condition, and yet you can have side effects or you can respond really well to that medication. And I may end up in an emergency room because I've had a severe reaction like allergy or so on. So that's what I did at the Mayo Clinic, really personalized medication treatments.
Yeah, and when I think about just like for the larger population of people, one of the most common medications that I think about is actually like medications for the heart, like that regulate blood pressure.
Yeah.
And there's such a difference based on our genes about how people respond to
Yeah.
these medications. And so I'm just thinking about people that perhaps like they get frustrated, they feel like their medications aren't working, and just like how do we invite them to open the conversation with their practitioners about, do you utilize personalized medicine to help guide what medications you're prescribing for me, right? Like super important. So just wanted to hit that point for anyone who's listening, because it's a really important role that you had, truly.
Yeah.
And now you're onto something so much bigger, and you've stepped away from an institution that has just really propelled you into longevity and
Yes.
taking that foundation
Mhm.
and moving forward. And I think it's like a really exciting time for people to be alive, honestly. Like
Yes.
we really have so much more power and control over what we're putting in our bodies,
Yes.
what we're doing to our bodies.
Mhm.
And there's so much data. It's almost like there's a data overload from like all of our devices. Like what's our Apple Watch telling us? What's our sleep patterns looking like with our Aura Ring? And
Yeah.
there's all this information, but how are we actually utilizing it to the very best of our abilities? And I think that's what's so exciting about your work and what you're doing. And I really want people to understand what's available to them and what does that look like and why is that important. So I'll let you just kind of like dive right in with like
Yeah.
with where we start here.
Oh my goodness, Jasmine, you're not going to be able to shut me up. So please have some sort of a timer so we can pause.
Okay,
There's,
that's Alex.
yeah, thank you, Alex. There's really a lot that we can do with that wonderful comment that you made in terms of which direction we want to go. So as I was hearing you speak, I was reflecting immediately, oh, wow, yes, I started, I've been in the world of pharmacology, which I absolutely love. And it's so misunderstood also for the past 3 decades. And this world of pharmacology, my philosophy really is everything is information. Everything from food to movement to supplements, medications, your thoughts, conversation that we are having, the environment, in all of that is information. And your body does something with that information, and vice versa. That information does something to your body. That actually is the world of pharmacology, also. And so I was always attracted to that from the very young age, and I've had some family members who have had their healthcare battles, including both of my parents. So I think I was informed not just from this love of science, but also from my personal experience with just seeing suffering that happens, unnecessary suffering actually, that happens to so many of our loved ones. And that really inspired me to say, well, what's going on inside of our bodies? And more importantly, what do we do when we uncover that there is something going off wrong? What do we do to help that person regain their health back? Eventually, I landed in this role as a pharmacist. I'm a pharmacist, nutritionist, healthcare innovator, but I landed in this role as a genetics trained pharmacist at Mayo, where I think when I think about where we are in healthcare, I'm a patient myself, where we are, how much confusion there is with what you see on social media, what you maybe read about or hear about. And then when you go to have that conversation with your physician, nurse, or a pharmacist, or whoever, it's really overwhelming to know how to navigate all of that. Would you
It,
agree with that?
oh my gosh, 100%. I feel like sometimes I'll hop on social media and look through, and I think the hardest part for me is looking at people who are not clinicians
Mhm.
giving a lot of advice,
Mhm.
and they're just really great salespeople, and they're
Mhm.
able to capture the attention of people who are listening and watching,
Mhm.
but they're not experts by any means. And I think if there's one thing that we really need to like get back to is looking and leading to the science,
Yeah.
right? And looking at the data, looking at the numbers and what we're seeing as trends. And that's why, having you here today is so great, because you are truly an expert in this space. Like, this is your realm,
Mhm.
and there's no one better to, honestly, like, everyone listening, like, there's no one better to listen to than Adriana.
You're so
So,
sweet.
like,
Yes.
truly, she's brilliant. And like, I know that if I go to your page, I can look at everything you're putting out in the world as reliable and credible, and I trust it.
Oh, that's great to hear.
Right? Like, and
Mm.
that's so important. Like, people have to trust people on social media based on not just what they think they're putting out in the world,
Yeah.
but looking at like what credibility do they have behind everything.
I think this is one of the reasons that I so connected with you, and hopefully we connected with one another. Is you recognize first, you recognize person sitting across from you is somebody who is as involved, as committed, as passionate, as has this integrity that brings to each of whatever it is that you do, be it patient interaction, be it maybe that you're in a meeting, be it leading your teams, whatever that is. And thank you for that compliment. I would say right back to you, I share the same. Going back to what you commented prior, this whole space of healthcare, where we are, what I commented on as far as the confusion actually led me to where I am now. And that is, I had, about this, but I had a health event which was very remarkable, major health event in 2021 while I was at Mayo. Now, mind you, this is still time, during COVID, kind of post, but still during COVID. So,
Yeah,
as
tail
you
end.
know, we were working nonstop.
Yeah.
There was no weekend, there was no time off. It was just nonstop. Whatever your patients needed, whatever your team needed, we did it. This is why I also feel very strongly when I hear, especially on social media, how healthcare system is um, corrupted, healthcare professionals, this and that. I had great maybe luck and privilege to work with so many other with so many healthcare professionals, from nurses, pharmacists, physicians, PT, and all of it, who were just stellar humans. And so when you show up, when you are part of that world where you have this excellence and expectations of how you actually care for your patients and hopefully one another, you just want to continuously bring your A game. So when I had my health event, it was actually a nurse. I was in ICU. I mean, we can go into that story if needed, but I was in ICU and at the Mayo Clinic. So when I ended there, folks knew me and I knew them. Whoever came into the room, more or less, I knew them. They were as equally surprised that I was there as I was. And, I logically could understand everything that they said and what was going on. I was in shock. I was alert and aware, but it wasn't until this nurse saw my face, just pure bewilderment on my face and being lost as a patient, not just lost as a healthcare professional, lost as a patient. She came to me, she did not say anything, Jasmine. She came to me and she just held my hand. And that gave me permission to cry. You're holding it together until you realize, my God, I am but a human. So, and that also really informed what I was going to do with what I'm doing right now. And that is, how do we protect our greatest asset, which is actually our health? And being a healthcare professional, as you know, my dear, is not really a certificate that you carry to say, I am the picture of health that's walking around. Many of us are not.
Yes.
And this is one of the things that I thought, okay, I am given a second chance at life. What am I going to do with this? Not only in terms of all of the science that I was involved with, these AI algorithms that I was involved with, what I was building or wanted to build, but also like, what am I going to do as me, as a person in my life? And how am I going to then connect with people who also don't want to be patients, actually? They want to be healthcare participants, perhaps, before being given that label as a patient. I don't want to have that label.
Yeah, and actually, we don't call the people that hire us as patients.
Yeah.
We call them clients, because I don't want people to be labeled as a patient. Like, I want them to be seen as humans.
Yes.
And so they're a client, they're requesting care, we provide it for them, right?
Yes. Yeah.
I think language is really, really powerful. And when we begin to change that, then I hope, we've talked a lot about, with you and other people on the show here, about patient empowerment and how they drive the care. Like, as clinicians, we want them to participate. We can't provide care to them on our own. Like,
Yeah.
it's an active process with everyone,
Yeah.
each bringing their own piece to the table, but only you know what's happening in your body, and only you know what you want.
Yes, and I think to maybe even dig a little deeper into that, I get pushback on this, but I still stand behind this because I've lived it, not only with my parents, family members, thousands of patients that I had this enormous privilege, Jasmine, just like you did, to serve and help, and also me as a patient myself. I heard you say this with your previous guest, and I believe in that. You are the expert of you. You may not understand or know what is going on in your body, but you live in that body. You live not only in that body, you're more than a body. So, body, mind, soul. You also live in communities. You are part of that community. So the old saying that goes, you are the five people that you hang out with. Yes, there is a lot of truth to that as well. So, when patients would come and see me, you mentioned blood pressure medication. Great example, actually. When patients would come and see me and said we would do genetic test or so-called pharmacogenetic test, which essentially means we look at your DNA, we know specific genes that we can look at to see if you have variants or mutations. And if you did, that means that those genes will make different kinds of proteins. And I don't mean dietary proteins. I mean proteins that serve function to help you move the drugs in your body and all of that, metabolize them, act on them, and so on. So we are able to do that test called pharmacogenetic test and then essentially personalize your medications. We can tell you, should you be better better served by being on atenolol versus metoprolol. Both of these are so-called beta blockers. They are used for a variety of conditions, but also to treat high blood pressure. And we know there is a number of us just walking this earth, at least quarter of us, who are unable to properly metabolize those medications, especially metoprolol. And so what you end up with is, if you're a so-called poor metabolizer, meaning that medication based on your genetics just lingers in your body longer, well, it's going to do what it's designed to do, and that is really lower your blood pressure and your heart rate, which you can then walk around with the daze, with dizziness, lightheadedness, and fall. And so patients would come and see me or see us for the service of pharmacogenomics. We would do the test. I would give them all of the recommendations precisely, as the guidelines would say that you should or should not be on metoprolol 50 milligrams or 25 milligrams a day. And yet, some of them would do great with that, and others would not. And that had to do with the simple fact that we still are not integrating the full person when we're assessing the guideline or the recommendation. Where is your gut microbiome? Where is your mitochondrial production of energy? And mitochondria are like little powerhouses of the cell, as we like to say, like engines of your cells, which do a lot more than just that. Where is your, proteome? Proteome is a universe of proteins that your DNA essentially makes, but proteins misfold all the time. So you could have a genetic leap, you could be normal, or you could have a mutation, and yet we may still not know how those proteins are actually expressed at this moment in time. And so stress plays a role, your environment plays a role, nutrition, movement, all of this plays a role. And that was the component that was still missing for me, which is what I essentially ended up building with my company now, which is what I believe in, this whole holistic approach to health using science, data, evidence. Even in the absence of guidelines, there is actually evidence. So how I'm really approaching this, Jasmine, is kind of like an N of one, based on the best evidence that we have.
And of me, right?
And of you, and of you, and of you, exactly.
Oh my gosh. So, I mean, I think it's really exciting. There's a lot of people thinking and looking to, like, how do I connect in with someone that can help me? And what would you recommend for someone who they want to start this process of diving into these parts of their body? They want to understand their microbiome. They want to understand, like, what's happening with their mitochondrial health. Like, where can someone start?
That's a really tough question to answer, and I'll tell you because two reasons. Number one, most of us, and I'm going to be real here, most of us healthcare professionals are trained in their specialty areas. So there is a huge fragmentation, meaning we exist within our silos. You can relate to that. I can relate to that. I think all of us can relate to that. So perhaps you would say, oh, then the answer to that problem would be that you find somebody who integrates that, like integrative medicine physician or healthcare practitioner, like an NP, PA, and so on. And I would say, yes, that actually is going to be a great place where you may start. Is that going to be enough? Likely not to answer really what you're asking me. The mitochondrial, this is a world, we are experiencing obviously revolution and evolution in technologies which are driving the same in healthcare. And so there is so much, Jasmine, as you know, that is just continuously put out there. The rate of medical knowledge doubles every 2 months. And that is actually expected to be even further reduced. How do we stay on top of that? How do we as healthcare professionals really dive into this world of multiomics and this system biology way of thinking? In other words, what I'm saying, for most of us, we're still not quite trained in that. So to really answer your question in the second way would be, you would need to find somebody who is willing to work with you, even if they're not trained, willing to work with you to explore what is out there. Does that make sense? More testing is not necessarily a good thing either, because it may bring more confusion. So finding somebody who integrates these body parts and looks at you as a person is probably the first place that I would start, because that's what I ended up doing. And I don't mean with my company. I just build a team around you. And so I heard your guest say, you should be at the driver's seat. 100%. You are the expert of your experience. You should be at the driver's seat. We actually work for you, not the other way around. You get to decide, who do you want to have at your table? Who do you want to have in your car? And then you can drive it together.
Yeah. And that's, I mean, we share actually the same philosophy. So that's the same way that we operate at Navi Nurses. It's the same, like, once a person has like knowledge and they have an understanding, they can't oftentimes see what the road looks like ahead,
Mhm.
right? Where a nurse can come in and be like, okay, if you choose this path, this is what 5 years out may look like. This is what, the next year may look like. If you choose this path, here's what this may look like. So I think each expert brings in this array of knowledge, and ultimately, when the person can make the decisions, because what you may choose for yourself may be entirely different than
Yeah.
what I want, right? And the most important thing is to always honor the person, honor the N of
Yes.
one. Right?
Always.
It's always that person. You're sitting here with me today,
Yeah.
and we're both operating in a space where people pay for our services.
Yes.
Right? Everything in healthcare for so many years has been like, it's covered by insurance. And we're realizing right now that people are paying more than their mortgages
Yeah.
for the cost of insurance. So much so that some people are foregoing it, right? They are really looking for alternative ways to make sure that they're healthy or to get the care they need, because it's not always happening. They get frustrated. They pay for insurance and they have a pre-authorization and they get denied and they're like, why do I have insurance in the first place?
Yeah.
Like, these things are like happening, and really not for the best. But what we're seeing is this huge tide, this movement of people willing to pay for the care that they want and they need.
Yes.
Right. So I'm doing that from the nursing perspective. How can nurses now be really like empowered to work for people? Because again, the person drives the care. The nurse is just there supporting them. Same thing for you. And it's really a mind, like it's a flip of the mind,
Yes.
and shifting the way that we've always seen it.
Yeah.
And there is so much value in having you own what's happening. So there is a huge amount of value in investing in nurses to come in and help you age in place at home, and to help you recover faster after surgery, because you're going to get back to your quality of life faster.
Yeah.
There's so much value in working with someone like you, who, yes, it is cash pay, but like, if you can work with someone earlier on who can help take a look at your like whole entire experience of where you're at today, and then stick with you and help you just continue to modify as your body changes, right, through everything. And especially for women, because I know that's a really important part for you. How do we help women, especially in the perimenopausal space? Like, how are they navigating all these changes that we don't have enough providers who know
Correct.
what to do and how to support them and guide them? And so, like, even if we give people the data, they don't know what to do with it. Like, this is great, but like, how do I take action on it?
Yes.
And what your company does is they provide the support for
Correct.
people. And so I guess my main takeaway is, I want people to see that there is so much value in paying for a service that doesn't just give you data. They
Correct.
give you the tools and the opportunity to really like make things actionable.
Correct. Correct.
Right. And they have to be willing to think about, okay, like, this is an investment in myself. I'm going to invest in myself and my own well-being because I value my health.
Correct.
And so I would just love your thoughts on that.
I have so many thoughts. I have so many thoughts. The first thought that came to mind was, oh my gosh, I absolutely love what you do. I completely agree with that approach and philosophy as well. And I think there are many actually economic cost, studies that show the impact of when you invest early on in what we typically, refer to as preventative health. The wonderful thing where I align with you and what I agree with is that, yes, if you invest earlier on in preventative health, there are studies that basically show that there are benefits down the line of essentially reducing your number of hospital visits, chronic disease management, which is incredibly costly, not only from
Yes.
medication point of view, but overall care and management, and even time that you spend driving around and trying to essentially find a physician, an office, an MRI, or whatever that might be. One of the things that we are very proud of this week, we onboarded some new employees, including a concierge nurse. So we obviously are a concierge longevity company, and what that means is we help people really be at the driver's seat of their health through very deep, advanced molecular testing and science, but that's really focused on lifestyle pillars, 6 lifestyle pillars: nutrition, movement, sleep, stress reduction, emotional, mental well being, and of course, substances, which would be, I don't know, personalized supplements, medications, and even peptides. There's a whole other conversation to be had. Um, but what I was saying is, what you were saying prior, another thought that came to my mind is, I always think about, oh my goodness, yes, there are folks who have means to do that, but there are many of us who absolutely cannot even begin to put together what would this look like for them. Like, I am deciding between my gas money, my food money, and the money that I need to invest in my health.
Yeah.
So what I'm going to say next is really important. You can protect your health. Your genetics is not your destiny. That's number one. Number two is you should be mindful and start building out practices in your own life that usually will cost you no money, from breath work to walking to deciding who you hang out with, what you listen to. All of this actually informs this internal built-in biology and pharmacology of these chemicals that get released, and they can essentially do either wonderful things for you or do a lot of damage. We all have cancer cells within us, every single one of us. Will they get really amplified and start to grow from the signals that we send or not depends on really what you do. And I know I'm very cognizant, oh my gosh, if I tell somebody, go ahead and buy spirulina supplement, they're like, first, I don't know what spirulina is. Second of all, that's really expensive. You don't need to go down that path, but you can choose to eat actual real food. Maybe through perhaps in your area, depending where you're at, maybe there are going to be some local, like farmers market, or some community sort of thing that you can do,
Co-op.
and co-ops. Exactly, that's what I was thinking of, where you can get some at least fresh fruits and vegetables, because we know that reduced caloric intake, prioritizing good type of protein along with good kind of fiber, especially fruits and veggies, is linked to expanded health span, which is number of years that you live in good health. So, and I think a lot of us here in the United States are also looking for band-aid like solutions. What's my next peptide stack? What's my next supplement stack?
So true.
We personalize supplements, by the way. Like, when we do all of this testing, we run a digital twin model to essentially predict, if you did this, what is going to happen. If you did these supplements, what is going to happen. Using the digital twin model, we essentially personalize your whole lifestyle protocol. And then, if needed, we build out your supplement, actual personalized supplements. But my approach to this, Jasmine, is also, it has to be, first of all, based on evidence, and it should not be some multitude of supplement stacks. Why do you need this many? And I know it's becoming really trendy with biohacking and everything else. I just don't see very strong data behind many of them. Sorry, I took us in an entirely different direction.
No, it's
but that's
okay.
what I wanted to comment on.
This is what we need to talk about.
Yeah.
I like have this firm belief that what happens is what needs to happen, right? So the conversation that we're having today is like what we need to hear and what we need to talk about. And I'm really grateful for you bringing up those points about, like, you don't have to pay for a lot of this stuff, right? Like,
Correct.
money is tight for so many people. And if we can provide them with free resources about, here's how to help, right? Like, it just, now, how do we ingrain that into behavioral patterns, which
Yes.
can be really hard for someone. I think even as nurses, this is something we work with for someone who's like a newly diagnosed diabetic, right? Like, there's a lot of things they have to be thinking about: changing their activity, like increasing activity, and changing their diet, and now taking insulin. There's so much at once. But we know from like human psychology that if we can do one small change at a time, that we can have sustainable and consistent actions that actually turn into something real. So things like breath work, right? Like meditation, start your day with a little meditation, start with gratitude, or end your day with some gratitude. And those things matter. Changing the music, right? Like, okay,
Absolutely.
so when we had the Inc. 5000 party, right?
Yeah.
Which you came to, and I'm so grateful for that. We brought in this DJ, Lincoln Jesser, and he came
That's
and
right.
played,
I remember.
and he plays music to the tunes that, like, the frequencies affect your body
Yes.
in optimal ways,
Mhm.
right? Like there's a science behind the type of music you listen to. So yeah, I listen to him all the time too. Of course, like I like his music is amazing, but like that matters. And I wanted to hit on just one other point too, because you brought it up. I think it's one of your pillars of the community.
Yes.
We know that connection is actually the number one predictor of our
Yes.
lifespan,
Yes.
how connected we are to our community. And I think what's beautiful about your philosophy is that, thinking about the genetics behind someone, right? If that one person can start to make changes, then they can hopefully impact their family around them who also have similar genetics, and what works for them may be beneficial and helpful for people around them. So like, nurses see like really deeply that health is not, it's not the experience of one person, it's the experience of everyone
Everyone.
around them too,
Mhm.
right? Like we talk about caregivers, and everyone in their community is being affected by the one person's health, and there's just so much power in that one person, right? Like
Yeah.
if we don't look for the quick band-aids, if we actually work on making the changes and investing in ourselves, the power that we can create in changing the behaviors and patterns of people around us, like, hey, we just finished dinner, like let's go for a walk together.
Yeah.
Right? Like make it a pattern of like walking with your loved one after dinner, and you get time with them, you connect, you're getting your physical activity, and maybe you're outside in nature where you're hearing birds and it lowers your blood pressure naturally,
Yeah.
right?
Yeah. One of my favorite, I love everything you said. I completely agree with all of that. One of my favorite peptides are little molecules that are made of like these amino acid chains, that do all kinds of really fun and interesting things in our body. And so peptides have become really trending topic recently because, and I think most people are probably familiar like with GLP-1s that are used for weight loss, but there's so many.
Yeah.
One of my favorite peptides is something that our body naturally makes, and it's oxytocin. So it is a hormone, really, that's properly, I would say it's a hormone that's released when moms bond with their babies after they're born or when they're breastfeeding them or playing with them. But it's also produced for men who are playing with their children too. It's also made when you have these really close one-on-one interactions. Taking that walk, having something like this really can imprint on your body in a way that is bringing those stress hormones down and building up more of this molecules of serenity like serotonin, oxytocin, and so on. So I firmly believe that this is something that you should be doing every day,
Yeah.
and it doesn't cost you any money.
Isn't like a 20-second hug also?
Yes.
It's like a 20-second hug with someone that helps do the same thing as well.
Yes,
Like,
yes, yeah, yeah. There are studies done in children who were hugged more frequently for also it's a frequency and it's also duration in terms of their immune system and even allergies. Even
yeah.
allergies, asthma, immune system, and all of this. There are studies, and you can pull them out. There are studies that you can clearly see that there is not only association, there is a likely something else more fundamental going on. We're social beings. We're wired for this. We're also wired to be in nature as well, which is I see so much of vitamin D deficiency,
Oh,
especially here
yes.
in
I
Arizona.
know.
And because we mostly work with founders, entrepreneurs, executives, but we also work with a lot of athletes, I always suspected that our athletes are going to be like biologically performing at a higher level or having better test results. They don't because they use up a lot of what they need. And oftentimes they'll run indoor as opposed to also being outdoor.
Oh, that's
Yeah.
fascinating.
It depends on the sport, mind you. Like tennis players, definitely not. But if it's more like,
Basketball.
yeah, exactly. Team sports, a lot of times they're all indoor.
Yeah.
Yeah.
Interesting. Okay. Well, you've given me so much to think about. And it reminded me of like, I hate being single. I was like, we talk about this all the time. I hate being single, but I'm like, gosh, if only I had a partner I could hug like every day for like 20 seconds.
Let's put it to the universe.
I'm putting it in the
Okay, so
universe.
whoever's listening, keep our dear Jasmine in mind. She's incredible.
Oh gosh.
Can I tell you something funny? We can cut this out. Speak about studies. You know, there are studies that also looked at women.
Uh-huh.
Now, this is mine being mindful of this, different stages of life, different season in life, right?
Yeah.
This is typically after menopause. So women who were married versus women who were not married. And they also did health span analysis. And meaning, you know, how healthy or how long they live. Lifespan would be more like how long they live.
I feel like I'm going to be excited to hear this.
You will be very excited to hear this.
Tell
So,
me.
interestingly, women who were not married but were happy in terms of their community, like maybe they had other women or even men or partners or something along that line, they actually did better than women who were married. And maybe this is very biased in terms of the countries that you look at, but that's what that's what it
Okay,
is.
so I guess I'm probably fine. I don't need the 26.
I wish everything that you wish for yourself. You should experience it all.
Oh my gosh, Adriana, that's so. Oh my God, thank you for sharing that. I love that. Is there anything like else, like just like burning in your mind that like before I hop away from this microphone, like I want people to know, yeah, just what do people really need to know?
So when I was thinking, thank you for asking the question. When I was thinking about your podcast, it's called Dear Patient. So what do you want people when they listen to your podcast? Who do you actually want to listen to this, and what do you want them to walk away with?
Yeah. So, what my goal is to bring together all of these experts who have just so much knowledge. And I want them to take a tidbit from every single one of them, whether it's how can I work on preventative wellness that will expand my longevity? How do I take care of my aging parents? Right, because there's stress even in that, like that all contributes back to your longevity. And how do I manage going to the doctor and being an advocate for myself? And all of these things, they're so important, and they all come back to the highest quality of life. If we can integrate all of the knowledge of all the experts I'm so lucky to be able to bring on to the podcast, then I want people to have access to like the tips and tricks that some of us know and some of us don't know, right? Like knowledge is so powerful, and if we can share it, then hopefully that just means everyone has a better quality of life. They can decide whether they want to listen to it and take it or not, right? But at least we're putting out the knowledge into the world of like, from my perspective, here's what I wish you knew. Here's what I wish I would have known if I was in that space, right? Because that could be life or death for someone.
Yes.
And that's so important.
That's beautiful. That gave me chills as I was listening to you lay that out. So we're very lucky to have you, Jasmine. We're very lucky to have you not just as a founder, this incredible, extraordinary founder of Navi Nurses, but also somebody who is an advocate, somebody who lives or has lived through these experiences. So and even if you have maybe not, I think you have this capacity, this enormous emotional capacity to sit, listen, observe, and ask, and then empower people who are in those positions. So thank you for creating this. It's beautiful. I absolutely love what you're doing.
Thank you for being a part of it.
Oh, my pleasure and my honor. I'm going to speak as a woman, healthcare professional.
Yeah, please do.
We women, and this also can depend on the culture that you were raised in, but I'm talking about women here, us in United States, Western world, raised in that culture. We have come a long way in terms of our freedoms, what we can do and cannot do. So we have come a long way, but we have long ways to go to. We need more role models. We need women who really are courageous to live in their integrity, be unapologetically themselves, And that doesn't mean, like, I immediately think about my boys, my husband and my son. I don't have daughters. They're my two closest human beings that I have in my life, including my brother. So all men. And without their support, I would not be able to do what I'm doing right now. But I also think about you and many other women that I'm so lucky to have in my lives and how differently they care or see me or support me than my boys do. They all love me. And I love all of them, but it's different. And so, what I want to say to our women, especially who are healthcare professionals, please take care of yourself and try to do it in a way that is consistent. So if you most of us are walking around metabolically unhealthy. Many of us who are now in perimenopause, menopause, and beyond. This is why I'm so close. This cause of empowering women as they go through hormonal changes is so close and dear to my heart because Jasmine, when I ended up in ICU, it's not just that I had this, I had a pulmonary embolism, but I also was in deep throes of perimenopause for years, not knowing that I had all of that. I was metabolically so unhealthy. I did not know any of that. How did I miss all of it? And so, what I am saying with this is before you pour into cups of others, and we are typically are the community builders as well, nurturers.
Yeah.
Before you do that, pause and on a daily basis think about, am I filling my cup? And am I filling it with the right stuff? And it's easier than it feels like. And when I say that, I mean, like, I work with a lot of women and they'll say, oh my God, Adriana, I have so much on my plate. Like, how do I find time for all of that? How do you eat an elephant? Start with small bites. So 5 minutes a day dedicate to yourself, or, think about who you're hanging out. Is there a meeting you can cross off? Is there a walk that you can take between the meetings? Little things that basically compound over time. So my takeaway with all of this is thank you for building this. These are real conversations, but we also need to make sure that we are building systems and communities where real talks actually happen. Like, let's do real work so you don't become this biological liability like I almost did.
Yeah. Oh my gosh, that's so powerful. Thank you. When you were talking, what it made me think about was women are the heart of making decisions in healthcare, right? So women are usually the ones holding the power of healthcare decisions. What doctors do we see?
Yes, as a family, yeah.
Right? What we're doing, all of those decisions are held by women. And so the healthier the woman is, and if that woman can take care of herself, she can not only role model the behaviors to the family, she can shape the family and have, a healthier family together.
Yes.
Like, that's so powerful.
Yes. And even in my world of longevity, we're so focused on biohacking. Longevity medicine is so ill defined right now. It's going through its own really growing pains. But longevity should not be a millionaire's game. And please don't get me wrong, we work with folks who can obviously afford these services, but the world of longevity, which is what we're talking about in health, in relationships, in business, and so on, should be really accessible and tappable for everybody. And these conversations that you are going to be creating on your podcast are going to enable that to happen. And so it will be something that you can go on a walk, and listen to Jasmine's voice or, their guest voice and think about, oh my God, how is this actually affecting the decisions that I need to make right now or what's happening in my life right now? Who am I missing in my car? Who do I need to kick out of my car, at least for time being right now?
Oh my gosh, that's the best metaphor I think I've heard. Who's riding in the car with me? Who's riding in my healthcare car?
Yeah.
Yeah. And not everyone has to be there the whole time.
No.
Yeah.
No, it's pit stops, right?
Yeah.
Little bus stops.
Oh my gosh. Well, Adriana, thank you so, so much for being here with me today. I'm so grateful to know you, call you a friend,
Likewise.
colleague, partner, all the things. So thank you for having us. What a powerful conversation that I just had with Dr. Adrijana Kekic. And if there are a few key takeaways that I want you to remember, exactly what she said. You are the expert on you, and genetics are not your destiny. You absolutely have the power to integrate behavioral changes, the small things that make a difference in your longevity starting today. Come do some squats.
Okay, come on, we're ready for chat. We're ready on chat. Hold on. Everybody.
Come on.
Everybody.
All of us.
I mean, if you like the camera, you need to do something.
Okay, 1, 2, 3, let's go. 1, 2, perfection. 3, 4, 5, 6, woo, 7, 8. 2 more guys. 9. And last time, make it count. 10.
We did go low enough. Thank you, Andre.
Absolutely.